March 20th didn't just bring the start of spring. It brought on allergy season too, the dreaded itchy and watery eyes. But in a pandemic, other symptoms may be worrisome because they can be mistaken for COVID-19. We spoke to Dr. Bannock from UConn Health, who explained more.
Now, COVID-19 and allergies, there is a lot of overlap between symptoms. Things like the nasal congestion, sore throat, coughing, those kinds of symptoms can be seen with both. I think there's a few distinguishing factors that are a little bit more likely to sway you to one versus the other.
Fever, chills, body aches, loss of taste and smell, and shortness of breath are all COVID-19 symptoms. Cough, headaches, fatigue, those are symptoms for both allergies and the coronavirus. Whereas sneezing, itchy and watery eyes, well, you can thank our allergies for that. Allergies don't usually cause shortness of breath unless there's an underlying condition.
COVID-19 affects all parts of the airways, the upper airways, so the nasal passages, the throat, but even down into the lungs. And that shortness of breath is really a sign that there's some lower respiratory tract involvement, so involvement in the lungs. That would be really much more characteristic of COVID-19. You can get some of those upper respiratory symptoms with seasonal allergies, but if you get to the point where you start to have coughing, shortness of breath, that's enough indication that you need to go get tested.
But it's good to be aware of any changes to your allergy symptoms this year.
A lot of people with seasonal allergies have the same types of symptoms every season. They even know what the triggers are for their seasonal allergies, exposure to certain things that are in the environment. I think it's important to know what your own usual symptoms are.
With overlapping symptoms, there may be some challenges.
It can be difficult to really make that clear distinction. As I mentioned, the things like loss of taste and smell seem to be quite characteristic of COVID-19, but those other symptoms, the upper respiratory symptoms, the fatigue, they can be seen with both.
If you still have questions or doubts on whether or not your symptoms are allergy related or not, the best course of action healthcare providers say is to get tested.
At this point, testing is very widely available here in Connecticut. And we don't have that delay time like we did going back to last spring when we were dealing with the same kinds of questions. So I think the message at this point, you have a little threshold. If you have any concerns, you do get symptoms, by all means, a testing would be the next step.
Rachel Piscitelli, Fox 61 News.